In this session, we are going to see another very important topic, which is an inevitable process of dying, that is grief and bereavement. Here, we will first begin with seeing and trying to understand what is bereavement and grief, and after that, we will do the various theoretical perspectives of grief. We will also see what is normal grief and what is abnormal grief that requires some kind of intervention. And we will conclude with the kind of coping mechanisms one can learn to overcome grief. Now, to begin with, after the death of a loved one, it follows the painful process of adjustment involving bereavement and grief. Bereavement is the acknowledgement of the truth that one has experienced death. So, the point at which a person realizes that yes, a death has happened, then from that point bereavement starts. And grief is an emotional response to the loss, and everyone goes through this process of bereavement and grief. So, what is normal grief? What are the symptoms that are associated with normal grief process? Now, people suffering from normal grief called as acute grief syndrome, and this entails that the person might be having periodic bouts of physical distress lasting about 20 minutes to 1 hour. They will also experience a sense of tightness in the throat, and they will also have the need to frequently sigh. These people also have low levels of energy, and they become very tired, they become moody, and they also lose interest in life. These people also have these feelings of emptiness, and in addition to that, they also experience intense anxiety. All these symptoms come under normal grief process or the acute grief syndrome. And the physical symptoms associated with this grief process include having difficulty in going to sleep, and many of them wake up suddenly during sleep and probably suffering from nightmares too. And these people also, some of them gain weight and some of them lose weight, because for some appetite increases and for some people there will be no appetite. And these people also show symptoms such as having headaches, chest pains and such uneasiness. They also, for some, there is lot of hair loss. And other physical symptoms include having an upset stomach because their digestive system will be having some problems. So, these are some of the physical symptoms of a normal grief process. Now, going on to the stages of grief. The first stage of grief involves shock and denial. In this stage, usually what people do is they try to divert themselves, especially involving themselves in the activities that are there after dying, like conducting the death ceremonies. So, they get themselves busy in trying to make all arrangements for the death rituals. And also you can see that there will be many members of the family or the friends visiting them, and these people try to put on a bold face. But the actual grieving process starts in the second phase, that is once all these things are over. So, in the second phase, the actual loss hits them hard, and in the second phase they start missing the loved one. They start crying and wanting to have the loved one back, and they also feel at a loss because they are not able to cope with the environment in which the loved one is missing. So, a process of experiencing intense emotions, and also lot of disorientation, and also lot of maladjustment happens in the second phase. Now, coming to the third phase, after a period of suffering, then the person will come to grips with reality and start accepting the fact that this person who they have lost is not going to come back, and then they start making positive efforts and try to adjust in the new circumstances. They also try in the final phase to replace some other person. For example, a very dear friend has died. They will try to make other new friends and make them as best friends, and in the process they try to slowly forget the one whom they have lost, and they try to let go. So, these are the typical 3 stages of grieving. Now, let us go deeper and try to understand what are the theoretical perspectives of grieving. Freud, the psychoanalyst, has his theory of grieving, saying that a person has lost someone who is dear to him, then this person will try to be ego defensive. So, the person will try to deny such a loss, and they try to use several ego defensive mechanisms to protect themselves, that is specifically in Freudian terms protect the ego. So, once the person is only able to come out of it, then only there will be adjustment to the grief. Coming to the next theory, Bowlby's theory of attachment. Actually, Bowlby's theory is the attachment theory. He says that when the attachment figure dies, the person experiences lot of grief, and he gives the stages of grief as beginning with numbness. So, the person become numb, especially not only physically but even mentally also, and then after the numbness stage of grief, the person will enter the yearning stage, where they will yearn for the person that they have lost, and this stage leads to the next stage, the disorganization and despair stage. And after becoming disorganized and also despaired for the person, the final stage of reorganization happens. So, in the stage of reorganization, you can see that the person once again recoups and tries to come back to life and lead a normal life. Now, let us go on to the next theory on grieving. According to this theory, there are 2 processes that are involved in the grieving process, and this theory is called the dual processing theory. Here the 2 processes are confrontation and restoration, and the grief experience alternates between both of them. Confrontation is the stage when the person will come to terms with the death experience. So, they start feeling bad for what has happened, and they grieve for some time. And the next process, the restorative process, is trying to overcome the grief by involving in positive behaviors. So, many other theories say that first the confrontation stage comes and then it is followed by the restoration stage. But according to the dual process theory, both of them happen together, and this alternate between the 2. Now, going on to the next theory, the Jacobs model of grieving, and he gives 3 types of grief processes. One is despair and depression, the red line, then the blue one, separation anxiety, and the third violet one, numbness and disbelief. So, in this figurative representation, you can see that the intensity of distress is highest when the grief response is numbness and disbelief, and this numbness and disbelief initially is high, but the distress gradually decreases to a point when it is very less. Coming to separation anxiety, See, different people experience grief in different manners. Those who have this separation anxiety, they have a medium level of distress initially, but as you can see, it goes on increasing till a point reaches a plateau is reached, and then there is a slow decline in the level of distress. So, coming to despair and depression, you can observe clearly here that the intensity of distress is very low compared to the other two, but you can see that there is a gradual increase in the intensity of distress, and the level of distress for people suffering from despair and depression is the highest, and it keeps on increasing, unlike those who are suffering from separation anxiety or numbness and disbelief. So, people who have this response to grief in terms of depression are the worst sufferers of grief according to Jacob's model of grieving. Apart from these theoretical perspectives, there are also a lot of research studies that were conducted regarding what are the patterns of grieving. So, researchers have taken several people who are responding to the death of a loved one, that is, who are in the process of bereavement and grief, and they try to observe what are the patterns of grieving. You can see the result of Watman and Silver, who found much variability in grieving, and they have listed 4 patterns of grieving. In the typical pattern, 35% of the people have this pattern. There is high initial grief, and again there is failure for quick recovery. So, here in the typical case, that is, majority of people have this typical response to grief. There is initially high level of distress, and also the recovery is slow. And you can see the next stage or pattern of grieving, that is the chronic stage. Here they have high distress, and it is also spread over several years, and they have found out that about 30 to 35% of the population suffer from this kind of or experience this kind of grief, and only 5% have the delayed grief response, and it means that the intensity of distress is low initially, but it keeps on increasing. So, as you can see, unlike in the typical and chronic, the initial distress is high, but for delayed pattern of grieving, the distress is low, and it is only 5% of the people experience this type of grief. And for about 25%, Watman and Silver found out that there is no grieving at all. So, although it is very positive finding, let us see why people do not grieve or when people do not grieve. People, if especially they suffer the loss, say, of a very elderly grandparent, probably who was suffering from several years with some disease, or who became completely leading a vegetative state of living, probably the death of such a person will be relieving on the survivors, and in fact there might be no despair or grief whatsoever. So, in their study they found that 25% of the time many people do not grieve to the death of loved one. Other research findings have shown that those people who are suffering from bereavement and grief, they increase their chance of death by 7%. So, during the process of grief, they themselves are easily susceptible to many diseases and also death. So, it is suggested the quicker the person comes out of the grief process, the better it is. And research also showed that there are other factors that influence the kind of grief that the person undergoes, and also the length of suffering. For example, the age of the bereaved. If suppose the age is above 60 or 70 years, then the survivors may not really suffer grief for a long period of time. But if the age of the deceased is quite young, and then the grief process takes a long time. And also other factors such as, say, the widowhood. There are many research studies which showed that death of a spouse has lot of impact on the person. So, if and especially the impact is more for men. And other social factors, like for example the kind of relationship the person is having, all that also influences the grief process. And financial status of the person and one's own personality makeup. For example, there might be some people who are very sensitive and who always take everything onto themselves, who are guilt prone. All these people have a longer period of grief, and also they have intenser level of grief compared to people who can take the things in their perspective and who can logically understand and who are positive oriented. And when the mode of death also has an effect on the kind of grief and the length of grief that one suffers. For example, if it is terminal illness. Terminal illness means that the other people or the loved ones expect beforehand itself that they, one day in the near future the person is going to die. So, the grief process sort of starts even when the person is alive. So, it concludes quicker after the person has died. But if suppose the mode of death is, say, suicide, then the grief process is very intense, and also the survivors have a sense of guilt. So, suicide is an unexpected event, so they are not prepared for the death. And also when there is some suicide, they feel that the survivors feel that they might have they might also have contributed to the suicide of this person, and they think they should have done something more to the person so that the person doesn't commit a suicide. If the mode of death is accident, then here also the grief is intense, because once again the death is not anticipated, and also if the accident, say for example if the person has died because of a fire, the person is burned to death, then such things are really horrifying to the survivors and the loved ones. So, the grief process is intense and also takes longer period of time. It has been found out that gender has a role to play regarding the kind of grief response. For example, it has been found that women are more emotional and immediately they respond to the dead person, and the grief process starts immediately, and they are quite sharing with others, they are quite open about their grief, they talk with others regarding the grief that they are going through. And women also are very expressive, they suffer from hopelessness, and their problems are intensified if their financial status and other issues interact with their grief process. On the other hand, men are less expressive of their grief. They try to sublimate their grief into doing some work which does not help in the long run. So, their grief process takes a longer period of time, and also these people, men do not show that they are grieving, nor do they share with others. So, grieving lessens if it is shared with others, and also if men try to put a bold face. So, they do not try really going into the grief process. So, that is why men are found to be suffering from grief for a longer period of time compared with women. So far we have discussed what the normal grieving process is, which everyone goes through when there is some death of the loved one. Now let us discuss what is pathological grief. You can see the DSM-IV classification. They give a list of the symptoms of bereavement. This category can be used when the focus of clinical attention is a reaction to the death of a loved one. If the clinician finds that the person's symptoms are because of reaction to a death one, then yes, this category bereavement can be used. And the second criteria they give is if it can be linked with a major depressive episode, that is feelings of sadness and associated symptoms such as insomnia, poor appetite and weight loss can be linked with a major depressive episode after the death, then also this category can come into effect. And the third criteria that DSM-IV gives is symptoms must still be present 2 months after loss. So, only if the clinician identifies that even after the elapse of 2 months the symptoms are still there, then only they can consider it as a disorder and start intervention program for them. And the last criteria that is given by DSM-IV is if it cannot be, the present symptoms cannot be considered as normal grief reactions. We have earlier seen the various normal grief reactions. If the symptoms of this present patient are not coming under any of the normal grief reactions, then also this criteria or this category is indicated, and when the clinician will try to diagnose that the person is suffering from bereavement. So, pathological grief is indicated when the depression continues even after 2 months. So, if the clinician notes that the person is still having or showing signs of depression even after 2 months, then one has to consider that as pathological grief. And another criteria is if the grief is lasting for more than say 6 months, then also it comes under pathological grief. And also another important thing is if the problems continue to occur even 12 up to 2 years after death, even after 2 years after death the person is having problems in adjustment, then also it comes under pathological grief. Now, once it is diagnosed as a bereavement and that the person is suffering from pathological grief, then the clinician has to give a sort of an intervention so that the person will try to come out of the grief. And so, certain techniques have to be taught to the person. So, before that let us see how to differentiate between grief and depression. Now, all of us know that depression is a pathological condition, and grief, the response to grief also seems to be closely related to the symptoms of depression. How to differentiate between the two? In grief it is experienced in waves, but whereas in depression the moods and feelings are static. That is, they are there continuously over a period of time, but whereas in grief those feelings of depression come and go. And another differentiation is the experience of grief or depressive symptoms diminishes in intensity over time, but in depression they are consistent over a period of time. And here in the grief reaction, the person, although suffering from depression like symptoms, they still have a healthy self image. But whereas for depressive patients, they have these feelings of worthlessness and disturbed self image. And another criteria for differentiating between the two is the grief person experiences hopelessness. There is hopelessness also in the depressive patient, but it is pervasive hopelessness. The next one is the people or patients suffering from this grief, they respond to support, unlike the depressive patient who are unresponsive to the support. And also in the grief patients there is overt expression of anger, while in the depressed patient anger is not as pronounced. So, it is deep within them. And coming to the last differentiation, the grief person is preoccupied with the deceased or that is the dead one, but whereas in the depressive patient there is preoccupation of the self. Now, let us see how to help those people who are suffering from grief. Because during the process of grief, we have already seen that there is 7% more chance of dying. So, the quicker a person comes out of grief, the better it is. And it has been suggested that when they are suffering from grief, it is better to express it. So, it is better to share with others than to hide the grief within themselves. When they share it with others, others will also be open enough and they will give their perspective, and listening to their perspective, it will help. And all of you might know this famous story where one wife grieves the death of her child, and the husband tells her that okay, you just go and borrow some sugar from a family that has no death, then I will revive your child. This husband has some spiritual power with him. So, this wife goes to each and every house in the village, and everyone is ready to give her sugar, but everyone says that there is one death or the other in their family. So, the wife learns a lesson that death is inevitable, and that helps her to overcome the grief to some extent. So, when we share with others about the grief, then they will come out with their own experiences and how they had deaths in their own lives, and also they will give suggestions and techniques to overcome grief. So, sharing with significant others and friends, it is very helpful in overcoming the grief. Other techniques that help in the grief process is to making sure that physically they are healthy by eating well, by exercising, by having a routine, and they can also have a journal about their kind of suffering that they are going through, and when they expressively write their grief process, it helps them to overcome. Other things that they can do is they can go out and spend time meaningfully with their friends, trying to forget the loss of their life, and most importantly trying to re-establish social relationships so that they can easily forget the dead person. And other things that can be done to help the person come out of the grief is by reading and learning about death. And also religion readily and spiritual values and spiritual philosophy also is very much helpful during this process of grief, because it is only religion that speaks about death and after death. They can also try to not suppress their emotions, but if they express their emotions readily, then also the grief process, although it seems to be intense, they will quickly get over it. There is a model about the grief process and how to overcome the grief process suggested by William Warden. He has a grief model which is very active, and he recommends that 4 tasks have to be done by the person who is grieving or bereaving to overcome grief. He says that the first task that the person has to do is to accept the loss. So, once the person keeps on denying that the loss has occurred, there will not be any kind of change or any kind of adjustment on the part of this person. So, the first step to do is to completely accept, yes, this person is no longer there for me. And then he also recommends the second task after the first one, that is to work through the grief. He recommends that one has to actively involve themselves in the emotions and not try to suppress them. They are advised to openly express their grief all their emotions. That is the second task. So, we have seen in many cases when they initially they try to hide their grief, then slowly that grief keeps catching up and they have a long duration of bereavement, which is not at all good either to their physical health or to their mental or social health. So, and the third task that Warden suggests is to adjust to an environment in which the deceased is no longer existing. Now, many people will have difficulty to go back to their own homes, where they will have difficulty seeing the empty room of the deceased. They will have difficulty seeing the clothes of the deceased, or they will have difficulty in living the same house without the loved one. So, he says that Warden suggests that one has to actively take measures to trying to adjust to the environment. And finally, he suggests that emotionally one has to relocate the deceased and move on. They have to let go and actively pursue other areas of their social relationships, and they have to move on in their life. So, these 4 tasks he recommends for a person who is suffering from grief, and they are in fact very useful in helping the grieved. So, in this lesson we have seen not only what is bereavement and grief, we have also seen the different theoretical perspectives explaining the various stages of grief. We have also seen what is normal grief and tried to differentiate it from pathological grief, along with the differentiation, important differentiation between grief and depression, because even clinicians try to get confused and in their diagnosis or trying to find out if it is grief or depression. So, the Teresa has given clear cut guidelines to differentiate between both of them. We have done that, and finally we have also seen what can be done to help a person overcome grief.